to hear from Dr. Adam Cutler, who is the Deputy Division Director for the International Relations and Media section of the Israeli Ministry of Health, who will be discussing enacting policies for verifiable COVID-19 credential requirements.
Thank you. Just one slight correction. I am not a doctor. Can you see my slides?
Yes, thank you.
Okay, so I'll be talking about reopening with vaccine verification. First of all, I want to note that we felt it was very much necessary as we developed our verification system to sort of have a two-tier system, one for domestic use, as well as one for international use. The different use cases required a different set of data be provided and a different level of transparency. Similarly, as we developed it, we realized that we needed a two-tier system domestically as well, with certain venues open with crowding and social distance requirements, and other venues open for vaccinated, recovered, and negatively tested individuals exclusively. As we reopened, very important to keep in mind the purpose of the reopening. We're enabling people to reconnect and restore a sense of community. We were enabling people to also reconnect and put behind them the isolation of the past year and a half. We were reinvigorating our economy, which took a tremendous hit, obviously. And we were creating the safe spaces where people could get used to social interactions again. People who were not used to being around large numbers of people for a period of time needed to acclimate to that. I'm not in presenter mode. Is that better? So considerations that we took, obviously verification and forgery prevention were very high on our list. Operational simplicity, we needed to develop systems that would facilitate smooth flow of people. When we talk about travel, we wanted to ensure that those vaccinated abroad or recovered abroad would be able to access the same venues as those vaccinated or recovered locally. And of course, ensuring the privacy of medical information. So we rolled out our vaccine certificate in late January. And we started holding conversations globally with different countries. At first, we were encouraging the global implementation of vaccination credentials, particularly to ensure that the infrastructure was there to support what we saw as the way forward. We encouraged the use of this credential as a travel requirement. There are certainly differing opinions on this matter. We sought to influence standards that were being developed, and now we slowly see the world coalescing around a smaller number of standards. And we sought to reach bilateral agreements as a precursor to multilateral agreements. This was an area where we did not find ripe ground. Essentially, we weren't yet ready to reopen travel. So while we did engage in really in-depth discussions with a number of very close partners, we did not actually pen any bilateral agreements. So the different components of our solutions, and we'll get to the solutions themselves shortly. First of all, we felt very strongly that the use of a passport number was important for international travel, not to make this a travel document, but in order to verify in a really robust way and a streamlined way for our airports that the individual presenting the certificate was in fact the same individual that held the passport that accompanied it. This was an area that whether due to privacy considerations or due to simply the lack of a link between databases, many countries were unable or unwilling to to meet. At this stage, we still include both the passport number and the national ID number in the Israeli certificate, but most countries, most standards make this optional, if at all. We went through a process of simplification of the minimum data set. When we first produced our vaccination certificates, we were including all kinds of information, such as date of validity, expiration date, batch number, the organization that had administered the dose, the organization that was issuing the certificate, in this case, the Ministry of Health. What we found is that as we've applied rules and coalesced around global standards, the data that's needed is much smaller than that original data set. And we're essentially down to name, date of birth for identification purposes, and on the vaccine data, a vaccine type and the dates of each dose is pretty much the only data that we're applying our business rules to. Similarly, we went through a process of simplification of the rule set. Initially, we might have been checking for period between doses. We might have applied different standards for different vaccines, and we realized that on a global scale, this really wasn't sustainable. And in order to facilitate travel, we needed to really focus on the key rules. In this case, you're looking at that a second dose has been administered. Generally, we're not going to be checking the interval between doses, although certainly there's value to that. And checking the identification of the individual, of course. And there was another component which was sort of unspoken, which was flexibility. Whatever standards we developed, whatever fields and data sets we used, whatever rules we applied, and whatever agreements we reached with other countries, flexibility was really a core value. In order to enable different countries to apply their own rule set. This is something that fortunately the European Green Certificate Gateway has also enabled each individual member country to apply their own rules and provided a transparency of data that, that enables that to occur. Further in our agreements, it was very important to maintain that flexibility in terms of a very dynamic situation on the ground in terms of health data, infection prevalence, and other considerations. So when we developed agreements, it was on the basis of mutual agreement, mutual recognition of the certificate itself. We were not writing a detailed list of protocols for travel. We felt it was important to maintain flexibility in that area. So here you can see our two certificates. My apologies that the domestic one does not include English. These are early versions of our certificates. The domestic Green Pass is very much a solution that maintains privacy of the individual. You can see essentially the person's status, their national ID number in this case. In the case of non-citizens, you'd have a passport number. Their children can be included if the child is a minor. And you cannot tell from scanning this certificate whether the individual is vaccinated, recovered, or negatively tested. You can only tell their status, and you can check that against an ID for identification purposes. The vaccination certificate is a very different use case. We felt that it was legitimate for other countries to require vaccination of foreign travelers. We felt that it was important to enable them to apply their own rule set and to give them transparency of data. And in this case, the privacy of the individual is maintained in that the individual decides who to present the certificate to, and only the individual can divulge that information. So essentially, you can see a very robust data set here not all of which is currently in use, including batch number. We have developed the ability to revoke certificates, something that we never used. And it's just a very different use case in terms of the necessity of providing the data. So the domestic pass, and here you see the app-based version of it, enables individuals to access certain venues that are only open to vaccinated, recovered, or negatively tested individuals. It maintains that medical privacy, and the period of validity varies by which status the individual falls under, testing obviously having a much shorter period of validity. The certificate itself is medical documentation for international purposes. That's why we've included the passport number. It provides the transparency, as I mentioned, and the holder chooses who to present it to. We issue a parallel certificate of recovery. And here are the components: the identification data, the details of the vaccination, and the QR code. In developing the QR code, it was very important to maintain that flexibility. We make the minimum data set machine readable within the QR code, and it is verifiable by a digital signature, both in online and offline formats. In terms of public reception, I'll talk first about the domestic case. We had a very enthusiastic reception for the domestic Green Pass. Essentially, we were rolling it out in a format where businesses that had been closed for a very long period of time were either being allowed to open or to expand capacity under the Green Pass system. So business owners received it very much enthusiastically. In terms of adoption, I think enforcement was perhaps a bit lax. Often you'd see businesses checking the pass itself, but not checking it against the ID of the individual, which presented some challenges for the effectiveness of the system. And that really is a matter of enforcement, whether a country wants to invest in the robust enforcement efforts. We experienced challenges in issuing credentials to foreign nationals. Often not having an Israeli cell phone number meant the two-factor identification process was challenging, and we needed to set up call centers and help centers in order to address the matter of foreign nationals, which is very much critical. When I have an individual coming into the country with a recognized vaccination certificate, I want to be able to issue them the same access to venues as a domestically vaccinated individual. And it's important it's an important component of reopening the tourism sector. We did phase out both the domestic Green Pass as well as the parallel restrictions. We did that over the course of June to the point where we had even phased out indoor masks. We're now in a process, as the Delta variant has arrived and seems to be growing into a fourth wave here, but we're in a process of reintroducing many of those systems, particularly the Green Pass system. And we're still in the very early stages, but it seems that businesses are adopting it, and people are continuing to use the Green Passes that they had downloaded earlier. The other recent development that I'll mention is with the coalescing around a global standard, we've decided from a national standpoint that it's worthwhile to align our standards with the European standard and join the European Green Certificate Gateway. And so we're in a process of realigning our data set in the way that the QR code is signed digitally in order to enable integration with the European system. Thank you, and I'm happy to answer questions at the appropriate time.